Good afternoon, everybody. Thank you so much for joining us for today's EI10 Speaker Series program on aging and access to care. I'm so pleased to have you all with us today, and also to our wonderful panelists who are going to be joining us to share their expertise on this topic. My name is David Griffith. I'm the Director of Programs and Outreach for the LGBT Elder Initiative. We are doing this virtual speaker series as part of our EI10 virtual events to commemorate the 10-year anniversary of the LGBT Elder Initiative. This is not necessarily the way we thought we would be celebrating our 10-year anniversary, but we're doing what we can in this new world of virtual programs and virtual celebrations. But again, thank you all for joining us, both for folks who are here with us in this Zoom, as well as for you who are watching us on Facebook Live, or anyone watching this recording at a later date. So we have a great program planned for folks today, and three really brilliant leading minds in the field of aging, who I'm so appreciative are taking time to speak with us today. Before I get to introducing them, I want to first recognize a couple of our great sponsors for today's event and for our EI10 celebration, starting with our diamond sponsor, Pennsylvania Health and Wellness, our two platinum sponsors, Philly AIDS Thrift and AmeriHealth Caritas, as sponsors for our EI10 series, as well as our two gold sponsors for today's program, the Philadelphia Foundation and BLBB Charitable, which is the giving arm of BLB and B Advisors. And so we are so thankful to them for their support of our work here at the LGBT Elder Initiative and of these 10-year anniversary programs. To tell you a little bit about how today is going to work, we are joined by Najja Aarp, Diane Menio, and Teresa Osborne, and I will introduce them momentarily. We have a couple of topics that we're planning to discuss related to accessing care, particularly for LGBT older adults. We also want to hear from you, though, in the virtual audience. So at any point, you are able to submit your questions through the Q&A feature at the bottom of your screen. It should be the bottom in the bottom toolbar, the Q&A, which you can pull up. You can type in your questions. There's an option to do this anonymously if you don't want your name attached to it. And so we will see that and be sure that we get to your questions. And we'll sort of be asking those throughout. You may have a question that we're planning to get to later in the program, so I might hold some of them, but please do ask your questions. We also have the chat enabled so that anyone watching us in the Zoom can put your questions and comments into the chat. I know there are a lot of also some providers who are on. You might have resources to share in addition to those that we're talking about, so feel free to put those in the chat. Just know that when you put things in the chat, it does attach your name to it. So don't share anything too personal or what you would rather keep anonymous. For folks watching us on Facebook, we do have a volunteer tracking the Facebook, and so who's going to transfer any comments. So if you have questions on Facebook, just throw them in there as a comment, and we'll make sure that our panel gets to see those. So without further ado, our wonderful panel. I'm going to just give each of you a chance to introduce yourselves, talk a little bit about your work and your agencies. I'm going to start with Najja Aarp, who is the president and CEO of the Philadelphia Corporation for Aging, who took on this role starting in, I think, April.
Yes.
Right at a very interesting time in the aging world, and had to come into this role and navigate our area agency on aging through this COVID pandemic. And by all accounts, has done a marvelous job in doing that. But so Najja, please take a couple minutes and introduce yourself to everybody.
Sure. Thank you, David, and thank you to the LGBTEI. Once again, my name is Najja Aarp, and I'm President and CEO of the Philadelphia Corporation for Aging. We are the area agency on aging for Philadelphia County. And like most area agencies on aging, we generally follow three paths when it comes to supporting older adults in the community. I'll say that first path is supporting older adults that really want to stay connected to their community. That's when we have our programs like senior centers, senior employment programs, health and wellness programs, things like that, just to make sure people have an opportunity to stay connected to their community. And then I'll briefly touch on that middle path. The middle path is where our care managers go into the homes, generally, in most instances, go into the homes and assess people to complete a comprehensive assessment to determine what supports and services we can put in place to really help them age in place in their homes and communities as long as possible. And then that last path would be advocacy and protection. And that's where we generally have supports and services like the Ombudsman program or legal supports, or more importantly, our older adult protective services to ensure we're doing our part to make sure people live free from abuse, neglect, financial exploitation, and abandonment. We are fortunate in Pennsylvania because through PCA, we have the lottery fund. And in addition to supporting our services in our office, it generally supports rent and property tax rebates for older adults, transportation services, and the PACE program. So very fortunate in Pennsylvania. And over the years, PCA has grown to supporting now more than 140,000 consumers across all of our programs. So it's a pleasure to be here with you this afternoon.
Thank you so much, Najja, and we're so pleased that you're able to join us today.
Thank you.
You're a very busy man, I know. Next, going to introduce Diane Menio, who is the Executive Director of CARE, the Center for Advocacy for the Rights and Interests of the Elderly. I'll put in a very quick plug that we are honoring CARE at our Cause for Applause fundraiser in January with an advocacy award for all of their work in supporting LGBT older adults. They were also incredibly instrumental in launching the LGBT Elder Initiative 10 years ago. So quite a testament to what we've been able to build since then. So we're very pleased with that and very pleased to have Diane here with us today. So Diane, I'll let you introduce yourself.
I'm sorry. I didn't want that to happen. Thank you. And I want to say we're honored to be getting this award in January and excited about that event as well. CARE has been around since 1977. We're an advocacy organization and all of our work is focused on advocacy. We like to think of what we do as a circle of advocacy. We help the individual through mainly through our CARE line, which is a call-in line where anyone can call about anything, and we will help you. We might help you directly navigate the system, resolve a problem, connect to services, but we'll never let you drop you. So we want to make sure that you've gotten the help that you need in any case. And then through our Ombudsman program, again, going out to see people in long-term care facilities and helping them with complaints. And we also have a healthcare fraud program and a victim advocacy program where we help people in courts. So those are direct work. And if you follow the circle around, that work really informs the rest of our work. It's the consumers who know what the problems are. And those of you who are consumers will know that. And so we learn that through the people who call us, through the consumers we come into contact with. And then we apply that to our policy work, which is really critical right now. And also to our training and education programs and outreach, because then we can, in one situation, we can maybe help one person's problem. If we can help if that person's problem is really something that many people are facing, we can maybe help many more by getting involved in policy advocacy. And the same thing with education and training. We have an elder abuse prevention training program, for instance. If we can help, that number, hundreds and thousands of people not be abused, that's, really stretches our reach much beyond the individual. And so it's all in very important advocacy for us. And we are available. We're on the web at care.org. If anybody, please use us if you need anything at all. Thank you.
Great. Thanks so much, Diane. And last but not least, going to introduce Teresa Osborne, who is the Advocacy and Outreach Manager for AARP of Pennsylvania. But Teresa, we first met back in 2015 when you were the Secretary of Aging for Pennsylvania. And I have a very distinct memory I'll share real quick, which was Heshy Zinman and I took the Amtrak out to Harrisburg to meet you, not having met you before. And we had a funny little conversation on the train about I hope this person's not some like crazy homophobe. And by the end of our conversation, we had invited you to be the keynote speaker at our next event. So little did we know you were this wonderful LGBT advocate, and did a lot of great work at the Department of Aging, and now carrying that over into AARP. So thank you so much for being here, and I will give you the floor to introduce yourself.
Well, David, I don't know if it's fair that you make me cry prior to me even saying 2 words, because those of you who know me know that I could tear up at the drop of a hat. So, but thank you for that fond remembrance, and I remember it well. And yes, having served as the 10th Secretary of Aging for the Pennsylvania Department of Aging was the honor of a lifetime. But in addition to that, I actually share a passion of both Najja's and Diane's, because I'm a former Area Agency on Aging Director for my hometown here in Lackawanna County, and Najja and I go back quite a few years in terms of his work. So congratulations, Najja, to you and all that you're doing in Philadelphia to carry on such tremendous legacy and following in the footsteps of so many that came before you. And to follow Diane is always a pleasure for me, you know, because I am in awe of both Najja and Diane and the work that they do. And Diane and I go back decades in terms of our advocacy work together. Won't tell you how many decades, but it's quite a few. We both started when we were like 2 or 3, I think, so it works out well for us. But now that I have the opportunity to be reunited on this platform via Zoom and Facebook with Najja and Diane and you, David and Heshi, it means a lot to me. And in particular, since I now have the great privilege to work with the AARP enterprise. You know, AARP itself is the nation's largest nonprofit, nonpartisan organization, completely dedicated to empowering people 50 years of age and older to choose how they live as they age. And with such a nationwide presence and nearly 38 million members across the country, AARP strengthens communities and advocates what matters most to families, including health security, financial stability, and personal fulfillment. We also here in Pennsylvania carry on that mission in terms of our 1.8 million members on Pennsylvania soil, in terms of ensuring that every day we are fighting for and being that fierce friend or wise friend and fierce defender with regard to ensuring that their needs, that their pressing priorities, financial security, caregiving, long-term care, everything we're going to talk about today in terms of food access and mental health and transportation and caregivers, and, you know, for the LGBTQ community, who their caregivers are, who they rely upon most, and as if we didn't have issues with navigating systems prior to COVID, we certainly have them during, and we are bound to have them after. But certainly it will give us opportunities to channel our collective resources in terms of making sure that here in the Commonwealth of Pennsylvania that we learn from these lessons that we're living through right now in terms of what's going to work for long-term care in the future, what's going to ensure that folks have access to mental health services, and so on and so forth. So to be involved in this work here in the Commonwealth with such incredible experts such as Najja and Diane and you, David and Heshi, and so many others, we're just so pleased and honored and privileged to join you for this conversation today. So thank you so much.
Thank you, and again, thank you all for being here. So let's jump into some content here, and I want to start by talking about mental health and access to mental health resources. Because we know that even pre-COVID, you know, mental health resources for older adults is a big issue, and improving access for that. COVID has really shown a light on I mean, I think all of us in some way have had some mental health challenges in navigating this pandemic. I'm going to start with Najja on this because you actually just testified not too long ago in front of the U.S. Senate talking about isolation of older adults, and there's obviously some links to isolation and mental health. So I'd love for you, Najja, to kick us off to talk a little bit about mental health access during these times.
Sure, you actually read my mind, David, when it comes to my recent testimony and talking really about an area of mental health supports that's impacted related to social isolation, which, you know, is something that hits all of us as we talk about what this new normal looks like for us as we're navigating this world through the pandemic. We knew that before the pandemic, 36% of Philadelphia and older Philadelphians lived alone and were at risk for social isolation. And recent research from the National Institute on Aging has told us that social isolation increases the risk of decline in cognitive impairments for older adults, as well as depression, comorbidities, nutrition, and physical activity. So we know that also for the city of Philadelphia, approximately 40% of Philadelphians are already linguistically isolated. So to us at the Area Agency on Aging, this is where the supports and services from a lot of the senior centers come into play, because not only as focal points in the community to help keeping people connected to their communities through rich programming and activities, health and wellness programs, but it also allows older adults to engage with one another and then receive a healthy meal while they're there, thereby trying to do their parts to decrease the risk of social isolation and those impacts of social isolation. One other program that we focus on as it relates to older adults and behavioral health issues is the Dom Care program at PCA and the other area agencies on aging, where we partner with many individuals that own homes within the community, and they are willing to and able to care for others that need additional supports so that they can once again stay safe in the community as long as they can safely do so. So we are proud of our Dom Care homes in the city of Philadelphia, and they do provide that extra support and service for those individuals that just need a little bit of support who may be suffering from some behavioral health issues. One of the things related to the impact of COVID-19, unfortunately with Dom Care, we've seen a decrease in the number of participants through the pandemic and a decrease in the number of Dom Care homes. So that's something we continue to advocate for, doing outreach for, to see if we can continue to look for new homes and new opportunities for older adults that need those supports.
Yeah, and I'm sure those senior centers also having to close. And I know we'll get a little bit to what the senior centers network has still been able to do to support folks. But if that was a large part of people's opportunities for interaction, and I'll throw in some of our LGBT serving organizations like William Way and places where people came for the socialization. And we've all tried to sort of move to virtual formats, but we know that doesn't work for everyone who we serve. I'd love to bring Diane in to just talk a little bit about what's on Carrie's radar in terms of mental health access.
Well, first of all, I'd like to thank Najja for coming prepared with all kinds of statistics. You saved me. And so, but no, I will just, like, going back, when I started at Carrie in 1989, one of the first meetings I went to was a meeting of the Mental Health and Aging Project, which was based at PCA. And it was really about getting people served through the mental health system. I'm not sure we've made a lot of progress since then. We still have issues with people getting services who have mental health issues in aging. There seems to be this big divide, especially when someone ages. When one of the issues that you have is that the mental health services are more administratively funded, where aging services are funded via Medicare and Medicaid. And so the funding stream is different. So when someone turns 65, rather than serving them in a community-based program in the community that has to come out of your budget, it might make, they try to get people to get into aging services, but aging services just don't seem to be prepared to be able to provide those kinds of services. One example I'll give you is the LIFE programs, which is all-inclusive care for the elderly. While they are required to provide those services, when they get somebody with chronic mental illness, it's not really, they don't have the resources to do that, unfortunately. But that's what we need. And now during COVID, we have people who are stressed, and Najja talked about isolation. Obviously, I don't know about any of you, but I'm getting tired of being in my house all the time, and it is challenging. And the other issue that we deal with is that vicarious trauma. My staff needs to be taken care of as well. And so we're doing some things to take care of that, but it's only so much you can do. And so we're trying right now. One of my staff is starting a Christmas card pen pal project to get letters to people who are isolated, so they can maybe be pen pals with someone else. To, just a letter, getting a letter in the mail, getting a phone call, getting, some of that. We're talking about mental health services, but I think we're talking about the broad range of issues that impact older adults. And when these things happen, who doesn't have issues that need to be taken care of? And so those, just a call, or, we have we have volunteers who've been out in the field for years, and now they can't be out in the field. So what they're doing now is calling people to support them. Those clinical services are different. And that's where I think there's still challenges. There's been challenges before, and there will be challenges going forward unless we change our systems. That's really where the advocacy comes in, and we work with many partners, people around who are, I was going to say around the table here on the Zoom. So anyway, I just want to say that it's a great need. It's always been a great need, and I'm sure especially now. And we know that our LGBT community is even more isolated in many ways, because they have, what we hear is that people don't feel comfortable even going to the services. And I think we've made some strides. Thank you to the EI and others, and people like Teresa, who made sure that the department was dealing with these issues, and Najja, of course. But what happens now when there's really no face-to-face, there's no ability to come together with people and have that reassurance? When you're on a screen like this, or you're on the telephone, it's much more difficult for anyone. And I'm sure it is in the LGBT community as well.
Yeah, thanks, Diane. And Teresa, I'd love for you to weigh in also. I know we're not quite at the we're not at the end of COVID. There's going to still be a long road ahead. But I mean, is there anything looking forward that we can be, as an aging network, be doing to increase access to mental health supports?
Sure. To follow Najja and Diane, so many thoughts went through my head to exactly, David, what you just commented on in terms of, what do we do next? Where do we take this? And to know that so little progress, so to say, has been made is sobering. My dad always told me, though, that even slow progress is progress. So we'll take it in incremental changes, but know that we have to do better. And with the volunteers that Diane just commented on in particular, and caregivers, AARP relies so heavily upon its volunteer network, as so many other agencies do. And it's heartbreaking to hear volunteers just completely overwhelmed that they're not able to be out in the community. We're human people in terms of, breaking bread with people, hitting them on the back, touching a cheek, hugging, caressing, and we can't do any of that, from where we're at right now with this coronavirus pandemic. And so the hopefulness of getting it under control and coming out on the other side of it, and whatever that new normal is, as Najja mentioned, is going to be, that certainly remains to be seen. But to keep volunteers engaged in all different types of platforms is so critical. And I know we're going to talk a little bit later about you can't be engaged unless you have access, and the digital divide is just as great as the divides in so many other areas of aging networks that we have. Never also in my lifetime did I think that I would be giving out the National Suicide Prevention Hotline number to so many people. That overwhelms me on any given day, especially caregivers, which is terrible. Caregivers, members that call our office and have a concern about a loved one in a facility that they can't visit, whether they're a nursing home, personal care home, or assisted living facility, not being able to go to their senior centers, see the people that they rely upon, being able to gather and support one another, and just reaching their end of the rope, and where rates of depression, suicidal thoughts, suicidal behaviors, it's hitting all ages and stages of life right now. And that is just an issue that is real, that we need to get our arms around, literally and figuratively, and address the barriers. Because often for older adults, I spent most of my young days fighting in local county mental health systems. Just because somebody turns the magic age of 60 doesn't mean that their lifelong behavioral health issues, are now dementia or Alzheimer's disease. Somebody that turns, 60 years of age and has had a lifetime of of behavioral health issues still needs the same level of support, if not more levels of support, as they desire to age in place and to age healthy and well. And the mental health system, unfortunately, just hasn't really kept up with that premise. And it's just incredibly sobering. And the last point I want to make is within long-term care facilities and, Pennsylvania, and, with its new community health choices program and health choices program, and wrapping physical and behavioral health around all the other healthcare needs that an individual has as they age in place. But I also have received so many calls from family members and members and volunteers with loved ones in nursing homes. And in particular, one 93-year-old woman who ended up in a long-term care facility due to severe dehydration and just needed rehab to build herself back up, and was so distraught that she was then in a facility, not able to visit her family, couldn't quite grasp how quickly everything happened, post an ER visit, a 3-day hospital stay, and then boom, you're in this facility to get yourself stronger, and literally wrapped a cord from her television set around her neck in an attempt to take her life, in a facility. And the facility's initial response, unfortunately, was, well, she's too weak to actually have been a successful attempt. Well, that's not the point. The attempt was the point. That behavior, that suicidal behavior, that suicidal action, that suicidal thought, just because she's 93 doesn't mean that she doesn't want to end her life because she's distraught. And failure to thrive really should not be the cause of death on someone's death certificate. And if we can't do better in Pennsylvania and across the country with regard to these issues during a pandemic, I certainly pray that we can pull our collective resources together and do better on the opposite end of it.
Absolutely. Yeah, thank you for sharing that. I just want to point out there have been a couple people putting some nice resources in the chat. So definitely encourage folks to keep an eye on that. Teresa, you actually gave me a nice segue in there to talking about caregiving, because it is something we want to have included in this conversation, knowing that caregivers are, even before COVID, have had some challenges in finding resources for themselves as caregivers, as well as for the people, the care recipients who they're caring for. And that's really been highlighted by COVID, especially when, as you mentioned, you might be a caregiver for someone who's in a facility. We know in the LGBT community, it's oftentimes kind of networks of friends and chosen families who are chipping in with some caregiving responsibilities, but may not be necessarily living in the same home as someone. And so that's been a lot harder to do since COVID. I want to start with you again, Teresa, because I know AARP has done so much work around supports for caregivers. And so I'd love for you to talk a little bit about kind of what that looks like now in this age of COVID and moving forward.
Sure. Thank you, David, for that. AARP, the enterprise of AARP is just amazing. And certainly I'm tainted, some would say, because I now work for them. However, just having resources available in order to share them with our fellow Pennsylvanians is just critical. And right out of the gate, as COVID hit Pennsylvania soil and so many families started to struggle, so many individuals, as you just well said, David, started to struggle, that in an LGBTQ community, relying upon family members and friends. And now you're hearing, well, stay at home and social distance and wear a mask, and where are you going to get those resources from? So right out of the gate, AARP did put out some family caregiving resources, literally called Preparedness for Caregivers during COVID-19. It takes the best of research from the Center for Disease Control and Prevention, the CDC, in terms of identifying, how family caregivers rather, how they tackle how to create a plan for themselves as well as those they are caring for. And if a caregiver became ill, there's always that concern of a caregiver becoming ill. And now with the pandemic, it's even more of a reality of what's the backup to the backup. So everything from pulling together a team of who those, resources are, to inventorying essential items such as food, medication, and basic supplies, getting medications in order and actually asking for extras in case that's needed, and creating a plan to stay connected. As we all just commented, that isolation is such a huge issue for us, and even more so with social distancing guidelines, and how you set up, FaceTime, Google Home, Skype, smartphones, or phoning or texting, or even driving by a neighbor's house, and waving to them at the window, as so many neighborhoods, engaged in. talking to facilities about when they're going to allow for visitation and what those positivity rates in communities are, which I know is a huge issue that Diane and her team have been working so hard on. And Diane also commented about sending cards and letters and magazines and puzzles and other items, to help folks in order to be safe and to ensure that they have, self-care engaged in that as well. So those resources certainly are available. We'll make sure that we put them in the chat or get them out to folks and links to our website, if you could put that in there as well, because there really are a plethora of resources available. Having them available is one thing, encouraging folks to actually access them is another. And where do you look? We are resource rich, but sometimes you get so overwhelmed you don't even know where to go. So hopefully folks now see our faces and know that they can reach out to any of us in order to try to get linked up with the services in their community.
Great, thanks, Teresa. I want to go to Diane next, because I know that Carrie does so much work in supporting caregivers, especially for folks who are caring for someone in a long-term care facility. We're going to get more into the long-term care side of it also, but I'd love for you to weigh in, Diane, on the caregiver support.
Yeah, I will say that, we always get calls from caregivers in the community and in facilities, but right now, by and large, the large numbers of people who are calling us are family members of people who live in facilities because they don't have access and they're frustrated. I will mention, since we're on Facebook, there are some really grassroots efforts out there. There's a page called Caregivers for Compromise. These are caregivers that are advocating to get inside facilities. And that's a big nationwide page, but Pennsylvania there's a subgroup in Pennsylvania. There's another one that is sponsored by the Pennsylvania Long-Term Care Ombudsman Program, which is called the Virtual Family Council, that meets weekly. And it's been very supportive to caregivers. It's hard. They're upset, they're angry. And, we, unfortunately, we're trying to do as much as we can. We did publish a paper on isolation, mitigating isolation in long-term care facilities. And by the way, one of the issues that we are very focused on is making sure that we're really not talking about visitation. Family caregivers are essential caregivers. They're as essential as the staff. And I will talk about this about nursing homes, but we have had staffing problems when this started, and there's staffing problems continue. My mother was in a facility with dementia, and if I weren't there, I'm not sure she would have gotten fed. And that she's not in this current time. And if my heart goes out to people who have to worry about that. And we hear stories about, I finally got to see my father on a compassionate care visit, and he lost 30 pounds. People are dying from dehydration and starvation and failure to thrive, as Teresa said. And family members are just distraught about this, and they need support, but they like the support, obviously. They support one another, but what they need is change. And that's what we're trying to work on, is change. And because this is just simply unacceptable what's happening right now. Caregivers deserve a lot more, and the residents deserve a lot more.
Moving on to you, Najja. I know PCA has a caregiver support program. So we'd love for you to talk a little bit about what that looks like, especially now when there are all these challenges in caregivers accessing resources.
Absolutely. And I'm glad caregiving was the second topic right after talking about mental health issues, because I really think the two topics are so really intertwined. And even talking about some of the things that Teresa and Diane mentioned a little earlier, that we're just so interconnected as individuals. We love that contact. And now with, as you mentioned, David, the senior centers closed, we've really had to pivot, for several months now to ensure that those focal points in the community, that we're really almost the front door for long-term services and supports for older adults, because people oftentimes would go to senior centers to stay connected and be able to engage in different programs, and then that would lead to other supports and services through referral to area agency on aging, and our partners at CARI and our partners at AARP, other community-based organizations, and those would often provide respite to our caregivers. So when you look at what's being done now, I think the senior centers have had to significantly pivot in their transition to a lot of virtual programming, where they were allowed previously to have people at face-to-face to participate in the program. Now they've had to pivot to virtual programs. As far as going back to the topic of Caregiver Support Program, this is one other support for individuals in the community. For those individuals that are caring for older adult loved ones, and they need additional support. Oftentimes they're looking for adult day services or looking for reimbursement for things like durable medical equipment and supplies. This is where the caregiver support could really provide that additional assistance to assist those individuals. One other piece of the caregiver support program that oftentimes people don't mention is the grandparents program, where there are grandparents that are oftentimes caring for younger children, whether it be other family members or their grandkids. And this is where the caregiver support program can assist those individuals with things like ensuring that they have after-school care or supplies for school. So there's definitely some gaps that the caregiver support program can fill in for those caregivers in the community. One of the things that we continue to advocate is just to make sure that Congress continues to look at small tweaks and adjustments to the caregiver support program, because right now the reimbursement has been for many years one of the lower reimbursements for than compared to other programs. So if we could really look at what's appropriate for today when it comes to appropriate reimbursement for our caregivers, I think that could really strengthen the program. Another area I think that we need to look at is related to the grandparents program specifically. For the area agency on aging budget, only a certain percentage of your budget could be allocated towards the grandparents program. But as we've seen over the years, there's been an increase in a number of grandparents caring for loved ones, caring for their grandchildren. So now it's time to really take a harder look at that part of the program to say, what can we do to strengthen, to ensure that families are staying connected and engaged, and they're able to care for their grandchildren as well.
We did have one question that just came in that I might be adding a little extra context to, but the question was, can you call a local agency and request a wellness check? I think this is the context of maybe a caregiver who does not live with the person who they care for, and might have some concerns about, is that person well and managing on the day-to-day. So what would someone in that type of situation do if you need someone to check on? And I think in this case, it was someone living independently.
Absolutely. Well, first I would say call your local area agency on aging, because we're not only going to make that initial call to that individual to see if there's other supports we can connect them to, but there's oftentimes other partners, community partners, that we make sure that the individual is connected to make sure that they're receiving additional supports and services. So we have, once we start connecting with those individuals, if they also are going to be referred to long-term services and supports where they may be, a care plan may develop to meet their needs, we may also connect with our partners at CARI, our partners at AARP, and if they're even members of the senior centers have also made wellness calls to individuals just to check in on them. We're looking at about 20,000 individuals that typically participate in senior center programming each year in Philadelphia. And right now, as they're going to virtual programming, they're making those calls to those individuals that are not able to be in the center themselves. So yes, please do contact your local area agency on aging so we can make that initial call and see what other supports we could connect them to. And then wellness calls will be a part of that.
Great.
I would just add for very quickly is that we do get calls from family members who are out of town and they can't reach their loved one. And I'm just, everything Najja said is absolutely correct, but if you can't reach that person, if the family member can't reach them by phone, we can't reach them by phone, you really have to call the police. They're the only ones who can get access to the home to check on someone if there's no response.
Thanks, Dan. I want to delve further into issues around long-term care, because I know this is such a big topic right now. You know, even before COVID, especially in the LGBT community, you know, there were a lot of concerns around accessing the long-term care system. I know there's some research recently from AARP that said over 2/3 of LGBT folks were worried about having to conceal their identities in order to go into a long-term care facility. COVID has obviously thrown in a whole new level of challenges for the long-term care system. Diane, starting with you, because I know this is something that Carrie is so steeped in right now. Would love to hear your thoughts on what's going on in long-term care.
Yes, we've been working since March, mid-March, on really this population in particular, and people who are in facilities are particularly vulnerable. And as Najja said, certainly people in the community as well. And we're still trying to help people with services in the community who are in the CHC program, for instance, and may not be getting services for one reason or another. They may have, we've gotten calls from family members who say, my aides are not wearing a mask. You know, that's a problem. So we have to look at all populations, but in the facilities, if anybody's read the newspaper or seen the news, you know that the numbers are extremely high. The deaths until recently, 69% of the deaths were in facilities. So certainly, I don't care who you are, you're going to be afraid to go into one of those places. It feels like a lion's den. There's a story came out yesterday in the paper. There's a facility out in Center County, Pennsylvania, where 90% of the residents are infected. That's just sobering. And so this is something, and unfortunately, we've been fighting for lots of things. I mean, one of the things we've been able to, at least somewhat successful with, is get a dialogue with the governor's office and the Department of Health and Department of Human Services. We meet every other week. And I believe, David, you've been on some of those meetings. Am I right? I think so.
I have, yes, with the government.
Anyway, it is, but that's a start. And we're trying to, at least we have a dialogue going, and we've made some gains here and there. But now with this surge, whatever you want to call it, it's something we couldn't have even imagined back in when we thought it was so terrible in the summer. And now this is just, so much more than what it was then. And we don't know what's going to happen. What we heard, I guess, at the meeting 2 weeks ago was that there were 220 cases a day in facilities, new cases a day being reported in facilities. Sadly, one of the things that we really have problems with is the reporting. And that's something that if you're somebody, a lot of people go into facilities because they broke their hip, they had a stroke, they need rehab. How do you make that decision when you don't know how many cases, whether or not this facility has cases at all, how they manage their cases? So that's one of our advocacy efforts. The other thing that people need to understand is that when this started, a lot of the regulations were basically, not enforced at all. Residents' rights have not really been enforced to any great, obviously the right to visitors has not been enforced, and others as well. And so we're very concerned about that, and would like to see things change. Teresa worked with us on, we did a deep dive into the nursing home regulations in Pennsylvania with an eye on what's been happening. And we've made lots of recommendations to the department. So far, we sent this 2 weeks ago. We haven't heard back from them, but we feel very strongly that this should be a learning experience, if nothing else, We should be able to go back and change this system so this never happens again. That is the most important thing about long-term care. The other thing I want to say is that we are going to see, when we talk about the future, we don't know what the future is when COVID's over. We don't know. What I can tell you is we're seeing steep declines in census in facilities. What we're hearing from some facilities is they can't operate with that low census. We have one facility in Philadelphia they call it right sizing, we call it downsizing. And there are other facilities that are going bankrupt across the state. After this is over, they already live on a fragile financial model. There's another issue here as well, is in ownership. There was a time back when I started in 1989, it was almost all nonprofits, government, church groups running facilities. Now, the church-based, the Archdiocese in Philadelphia sold their homes to a for-profit company. And strikingly, when I looked at the initial numbers in facilities, those were some of the worst. They used to be the best places you could go to. And they're not anymore. And the public doesn't know that. And so we're very, very concerned about this industry. I think there are a lot of people who would like it to go away, but we certainly have to figure out how to manage issues that people need to have managed who go to those facilities. And maybe that's a bright spot for LGBT elders, is that we could start looking at creating a system that really includes everyone. And I will say, just so you know, that we did look at the regulations, and we put language in there specifically regarding LGBT because it's important. And we made sure that, that this was recognized throughout the regulations, that we weren't, turning our back on that, when you're talking about treating people equally and what they deserve to have. And so that is, that's something that we're doing, and we're hoping we can move forward with that. Of course, this surge has been challenging, very challenging, obviously, for the state. So anyway, I will just leave there, and I will say that I mentioned our position paper on mitigating loneliness and isolation. And also we have a very comprehensive position paper, which again, Teresa helped us with, on the entire, everything that needs to be done to fix, from testing to PPE and you name it, to fix this situation. So all of those things you can find on our website and at www.carry.org. So I encourage you to go look for that. Thank you.
I want to add in on that, Diane, with the LGBT piece.
Oh, you worked with us as well. I forgot.
Well, just to say on the specifically, because you mentioned earlier or maybe Teresa did, the essential family caregivers having more visitation. Yes. And we did clarify, and the state did go with that. Family caregiving it's not strictly traditional versions of family. That family caregivers in these purposes include your friends.
And that was something in the regulations that talks about family. Mm-hmm. And so we wanted to make sure that they understood what this is. It's not family. Right. And we call it, the resident representative, mm-hmm. Whoever that may be. So that's what we're proposing in the regulations that we gave them. That's great. We'll see what happens.
I'd like to go to you, Teresa, to weigh in, both on sort of the navigating COVID in long-term care, but also if you can speak a little bit to the sort of making the system more LGBT inclusive to eliminate some of those barriers and concerns in the LGBT community.
Sure. Working with the work group that Diane referenced, and the work group might be the right name. It was passionate advocates, I'll tell you that, in terms of, and the knowledge base is just incredible. I learned something on every conversation that I participated in. But from an AARP perspective, certainly, and it's shared widely, that, we want to ensure that every policy recommendation that we're putting forth, that it promotes equality, and that it advances racial, economic, and gender justice. I mean, they're just key elements that, they can't just be you as understood. They have to be out there and articulated and understood and grasped. And if you're not sure what those words mean, that, you know, you can pivot to somebody that's going to explain to you what those words mean. And they mean a lot to us at AARP. You know, and with the nursing home and long-term care system, you know, Najja mentioned a moment ago about the critical importance of senior community centers play, as well as dom care, as well as the family caregiver support program, that hopefully picking up from the groundwork that was led, you know, this year with the 2021 legislative session right around the corner. That's something that we can continue to advocate for, both here in Pennsylvania, to take some of those handcuffs, so to say, off that program, so that area agencies and aging can have an easier time facilitating it and getting folks enrolled into that program and benefiting from it. AARP, though, within the nursing home, and Diane mentioned already, you know, that long-term care facilities really became ground zero for the coronavirus. You know, here in Pennsylvania alone, over 6,500 residents have died from COVID-19. That's 62% of all coronavirus fatalities in our state. You know, and the fact that, you know, an AARP dashboard, you know, that comes out once a month, you know, that is giving us really good information, but it's also, to use, now I'm using this word for the third time, sobering information, in terms of nursing homes, you know, nationally even continue to face a shortage of PPE. You know, in Pennsylvania facilities, some of them are still facing shortages of PPE, and we need to ensure that those direct care workers and other staff within facilities, that whether they're providing assistance with bathing, medication, cleaning their room, cleaning their laundry, delivering a meal, picking up a meal tray, taking out the garbage, whatever their role is in those facilities, those workers, they deserve not just our respect and admiration, but PPE, you know, in terms of keeping them safe, so that they're also safe when they go home to their own families. Direct care workers, you know, is the workforce, and life-sustaining wages, you know, clearly has been talked about for years, clearly being talked about during coronavirus, and it's not going to magically disappear when we emerge from this. But that protecting nursing home residents from COVID, you know, is certainly a state issue, as well as a congressional issue, as Najja mentioned earlier. You know, funding that comes from Congress to the states in terms of how that's being utilized, what it's being spent on, that it's being spent on safety measures, health and safety measures for residents and staff is just key, and it's just really pivotal. I also, the last piece I want to quickly comment on, because like my other colleagues, I'll go on a tangent, and the last place you want me to be. But the last thing I do want to comment on in terms of the long-term care continuum. So I do think Pennsylvania for years has prided itself on having a continuum of care. You know, the issue always has been accessing that care, and that still is not a riddle that we have fully solved. But, you know, we're also going to have some gaps, and I know Philadelphia is already seeing it with regard to adult day centers. So adult day centers that haven't been able to open, understanding and respecting the safety measures behind them, but even giving adult day providers opportunity to provide, you know, telehealth services. That's a whole other issue in terms of Pennsylvania and payment provisions outside of an executive order for telehealth. But adult day providers that provide that respite and that key connection to individuals, and now with the new payment system with Community Health Choices, you know, who are those providers that are paying for that, and in addition to funding through the area agencies on aging, as Najja mentioned earlier, from the Department of Aging, and thank God for our lottery fund. But you know, that's a concern in terms of where those gaps exist. This wasn't a gap before coronavirus, but it certainly is a gap during, especially in certain areas of the Commonwealth, and zip code shouldn't matter in terms of accessing services. So, you know, we need to do better in our long-term care continuum, really take a deep dive in terms of what Community Health Choices has meant. The last phase of it got rolled out, you know, 2 months before coronavirus hit, you know, and what about enrollment, and what about the independent enrollment broker, and what about how folks access these services? So a lot of unanswered questions, which is unfortunate, but, you know, so many, again, lessons learned, you know, through this coronavirus to ensure that, you know, not only are we making the best decisions with the limited resources entrusted to our care, but at the end of the day, that equality piece and that gender justice and racial and economic justice is all a part of that. So long-term care, it definitely consumes a lot of hours in our days, but they're hours well consumed, because the advocates are the ones who need to keep pressing on these issues to ensure that CARES dollars or HEROES dollars and CARES Act 2, whatever the next stimulus package is going to be, and entities that are going to benefit from it, that there is transparency in terms of how those dollars are being spent, where they're being spent, and at the end of the day, it's the residents and the staff that need to benefit from those dollars most. They need to be served and protected.
Thanks, Teresa. We have a lot of topics to still get to. I want to keep us moving, but I want to give Najja a chance to weigh on this. If there's anything you want to share on the topic, Najja.
Oh yeah, I could not agree more with Diane and Teresa's last as well, because I think that this is an opportunity now that we have to look at lessons learned from the pandemic. And this is a time now where I don't think we go back to business as usual. This is an opportunity for us to really look at different ways that we could look at how services and supports are provided, different ways that we can be innovative and creative, looking at different pieces of technology like telehealth. I know that one of the challenges that we face here in Philadelphia is the digital divide, but what are some ways that we could partner with different agencies and different collaborative partners, bring people together so that way we're tackling that. So telehealth is a more robust resource available to the consumers in the community. And definitely looking at policies and procedures. This is something that now is the time for us to really say, once again, let's not go back to business as usual, but really look at ways that we look at the policies and the procedures and say, what are ways that we could be more inclusive in the supports and services that we provide? How can we collect data better than we've done in the past? And then making sure that we look at ways that as we speak on the social determinants of health, what are some ways that we could really end some of the disparities there as it relates to the consumers that we serve? So once again, I'll say again, it's not business as usual. Now's the time for us to really look at different ways that we could tackle some of these historic challenges going to the future and handle them differently.
That's great. Thanks, Najja. I'm going to pivot topics a little bit. I want to talk about food and nutrition and food access. And I'm actually going to start back with you, Najja, because this is something that's been very much in PCA's wheelhouse, focusing on meals. And knowing in a large city like Philadelphia, where we have high rates of poverty in our older adult community, in our LGBT community, that food insecurity is a really big concern, made worse again by a pandemic. But I'd love for you to start us off on that topic and talking about sort of how to improve access to healthy and nutritious food for older adults.
Sure. It is definitely something that we take seriously, is tackling food insecurity with older adults. We know that every year Philadelphia is, as I mentioned, I think earlier, either number 1 or number 2 in the 10 largest cities with the deepest level of poverty. So we know that impacts people's ability to combat food insecurity and have access to fresh fruits and vegetables and healthy, nutritious meals. That's typically where we see our home delivered meals program come in, or the congregate meal programs through the senior centers. I'll start in reverse. With the congregate meal program, as I mentioned, the senior centers are closed for programming outside of virtual programming. However, they've transitioned to grab and go meals during the pandemic to ensure that those individuals that are in need of a nutritious, balanced meal, they could still access that through the senior centers, through the grab and go program. For the individuals that are not able to physically get to the senior centers, that's where our home delivered meals program comes in. And that's where our care managers or service coordinators will generally assess those individuals, see if they're eligible for our home delivered meals program. And then those individuals that can't get to the sites, to the centers, those meals will be delivered to those individuals. It's interesting that when the pandemic first hit, we saw a decline in majority of our programs. And then I think as people were trying to hunker down and figure out, what does this mean as far as sheltering in place? What does this mean now with social distancing and making sure you have the proper PPE and masks and following the proper guidelines as spelled out by the health department. But then over time, over the weeks, we saw our numbers start to increase, and they've continued to increase since then. So we generally serve about 1.8 to 2.1 million meals combined between congregate meal and home deliver. we're on track now to exceed those numbers due to the pandemic. As we look to the future, as I mentioned, one of the things we have to do is just make sure that we look at a different way of providing these supports and services. As we will continue to meet the mandates as required, making sure that our meals are nutritiously balanced, 1/3 registered diet for older adult, daily allowance for older adult. But what can we do to make sure that they're more culturally sensitive? What can we do different to make sure we're doing a better job of tackling those pockets of the city that may be underserved? So these are some of the things that we're talking about and looking at as we think about now going into the winter months where flu season's hitting. And some people think that we'll be still possibly dealing with COVID beyond our fiscal year, June 30. But now is the time for us even to start thinking about and looking at how do we expand nutrition services now as we see related to some of the things we've seen with COVID.
Thanks, Najja. Gonna go to Teresa for a similar question. Kind of what's AARP doing? What's on your mind around senior hunger and malnutrition? Oh, and you're still muted, Teresa.
Yeah, let me unmute, or maybe you want me to be muted. I don't know. We'll see. Yes, thank you for that. So, a big opportunity that AARP actually has this week is across the country and here in Pennsylvania, we're engaged in what we call virtual lobby days. So, we reached out to all 18 members of Congress, 18 congressmen and women, and our 2 senators to ask them to meet with us, both staff from the state office, as well as some of our volunteers, our key lead volunteers, including our volunteer state president, Joanne Grossi. But in SNAP is one of the programs that we are talking about in terms of the nutritional subsidy for folks. So, this is not, people struggling to put food on their table. Hunger is not a political issue. It's a daily reality for them. And we are asking Congress now actually to temporarily increase the SNAP maximum benefit and the minimum monthly benefit to help ensure people can afford the food they need to stay healthy. The picture that most often first enters my mind is a visualization that Najja referenced earlier, and that's grandparents raising their grandchildren. So when I think of SNAP and I think the digital divide, I'm picturing grandparents, struggling, financially to put food on the table for them and their grandchildren, struggling to get through classes online, when perhaps they don't have good internet service or internet service at all. Just as an aside to that, I was on a call with a few key volunteers earlier today that have broadband and high-speed internet access service in Pennsylvania as one of their main issues that we're focused on, especially as we plan for 2021 and the legislative year there. But I was overwhelmed when I was informed that in a part of Bucks County, that there's a 300 plus housing unit that, doesn't have internet access. And, the volunteers on the phone were like, what can AARP do about that? There's grandparents raising their grandchildren there. There's, kids who are trying to, be engaged in school. There's folks trying to do online banking or order food online. And they hear, in a part of Pennsylvania that's not even rural. That's usually where your head goes, is rural Pennsylvanians. But the food insecurity issue is a definite tie to all the other issues. If you don't have good, nutritious meals, everything else really falls apart. Your social well-being, your health, well-being, your physical well-being. And if we can do more to parlay the services that Najja and the other area agencies on aging are providing in the food security network, and help SNAP to be that vital lifeline as well for those folks. Over 934,000 Pennsylvania households use SNAP as a lifeline, and over half of those have at least one eligible adult 50 years of age or in those homes. And that's a key component for us, is to ensure that SNAP remains a viable benefit. I do think the Commonwealth of Pennsylvania, with the administration's efforts on food security and the food security summits that they've had through the years, and thankfully making sure that area agencies on aging and the Department of Aging were part of that, because they serve a lot of meals, as Najja just described, both congregate and at home deliveries. It's just a major piece of the safety net that we're trying to make sure is held together, because folks need access to food.
And Diane, anything to?
Oh, I won't belabor
comments?
it, but I thank Najja and Teresa for being so thorough. I just want to say that, you know, Najja's right. The Philadelphia has the we're not first in a lot of things, but we are first in poverty. And we have more older adults in deep poverty than any of those other large cities. But we're also first in poverty for the population in general. And, you know, what happens in some families is that the older adult is getting a home delivered meal and they're sharing it. They don't get a lot, you know, they don't get enough to share with the whole family. But that's what they're doing because, of course, that's what families do for one another. And so we really have to tackle this problem as a society. You know, when I saw the lines of people waiting for food all over the country after COVID, it's just staggering. It's so upsetting. I can't even imagine people having to worry about that. And so, so I do think we have to tackle this issue for everyone. And, you know, it was good to see the schools providing food. I'm assuming they're still doing that. I'm not sure, but they were initially. And I think that was good for families. And I don't think they were being picky about who picked up a meal. And so I think some things good things are being done, and we need to continue that. We can't let that stop when COVID's over. Yeah. If it's over. I'll be more optimistic when it's over.
There was one question that came in here, and I think I know the answer, but I'm going to let Najja answer it, which is, are frozen meals available as part of the PCA's home deliveries?
Yes, we do have frozen meals as an option. People have an opportunity to select frozen or hot meals depending on their need. We typically assess their need and pair them up with the type of meal that most appropriately serves them. And if frozen is their option, then we definitely go with that.
Great. Thanks, Najja.
You're welcome.
I want to talk a little bit about transportation, because this is obviously something a very practical issue when we talk about accessing care and resources and services from the Aging Network. Diane, maybe you can start us off on that, because I know Carrie has does.
Yeah, we have a transportation advocacy program where we try to help people in Philadelphia, really with SEPTA and shared ride. Unsponsored rides. PCA deals with sponsored rides. Those are the ones that take people to senior centers and places like that. And so we are, there's been basically a huge drop off. People are not, people don't trust getting on public transportation right now. You certainly saw the problems SEPTA had in the beginning, and tragically, many of their staff were impacted by this, either infected or died from it. And so again, this is a system that we have to think about. How do we make sure, because it's so important to keep people connected, to go to doctor's appointments and things like that. There's, I also want to remind people that there's a Medicaid transportation program. So if somebody is in the CHC program or on Medicaid, they can take advantage of that. But that too has problems. And transportation, by the way, is also an age-old problem of, people schedule a ride and then, they wait to get picked up, or they're picked up very early, or they're dropped off, they wait a long time where they are to be picked up. That's very challenging for somebody who is, compromised both physically and health-wise. And so that's a huge problem. It's always been a problem, and now it continues to be a problem. Although I will say that what I heard from my staff person is that in some cases it actually is working better because it's not being used as much. So that's something that, but still it's not, we have a lot of work to do to fix our transportation system in Pennsylvania and in the city. I will say that it's challenging, and I don't think that's a surprise to anyone. That many of the people in our city don't drive cars, and my staff doesn't drive. Most of them don't drive cars. I mean, they can, but they don't have them. And so what do you do? how do you get around? Unfortunately, my staff uses their bicycles. So, but that's not going to work for everyone. So anyway, I'll leave it short. Thank you.
And Najja, I know PCA deals with this pretty closely. So we'd love to hear your insight also in terms of how to sort of improve some of the ways that the transportation for older adults can manifest.
Yeah, I agree with the comments Diane made. Transportation is certainly an age-old issue that not only needs a close look at, but some additional resources as well to really make sure that it's a more robust support for the older adults that are out there in the community. I'll go back to comments I was made earlier. I think now it's time to really look at creative and innovative ways also to do things differently. If it's appropriate pieces of technology to make sure that the rides are even more efficient than they are now, because Diane mentioned oftentimes the longer waits and making sure that people are scheduling far enough in advance. So what pieces of technology could additionally support the efficiency of rides, or even looking at pilot programs that could maybe use things like Uber or Lyft to support older adults. I think if the traditional forms of transportation could be strengthened or some pieces added to it, I think that's where we can get creative ways to really look at the future of transportation for older adults and people with disabilities.
Right. Yep. And Teresa, would you have anything to add on the topic from your AARP side?
Yeah, actually, just real quick, from a research side with the AARP, we also, researchers tell us, 51% of Black individuals, 53% of Hispanic, and 51% Native American workers, across the country hold jobs that must be done in person, compared with 41% of white workers. So, I pulled that statistic up because as I, listened to Najja and Diane speak, in a city like Philadelphia that is so dependent for the most part on public transportation, it's like, what, how are these folks taking care of themselves safely on a public transportation route system? Or, more personal to me real quick is my husband works in the healthcare field as a transport driver. His primary job had been, prior to coronavirus, taking older adults to partial day programs. Now, it proved interesting sometimes when he started to give my card and number out to folks. So that was fun. I broke him of that habit. No, I'm only kidding. But with coronavirus, those partial and day programs really were non-existent. They weren't happening. They slowly are coming back. But one of the biggest routes that he runs is taking folks to dialysis, or taking folks home from hospital, from rehab centers, from drug and treatment program facilities, sometimes from here where we are in Lackawanna County to Philadelphia. When I think of those workers, like him and others, there's countless others that mode of transportation is critical, to folks getting home, getting where they need to go. So I think of even the transportation in the different sense of, the protocols that families like mine have to put in place when they come home from work, from where you enter your home, take off, your shoes, your clothes, how you're throwing them in the washer, the dryer, how you're asking your company for various pieces of equipment to keep yourself safe, from masks to shields to PPE, especially if you have to go into some facilities. So, transportation for me as an advocate has taken on a whole different meaning, I'll say, in the past 9 months. As Diane and Najja mentioned, we had issues in the transportation realm, getting folks from portal to portal prior to coronavirus, and now it's just broke open this whole other phase of how you keep yourself safe when you have to use public transportation, how you get to your workplace when you're not allowed the privilege, like I am, to work from home. A lot of folks look at our long-term care workers. They can't work from home. You can't give someone their meds or clean their clothes or change their bed sheets, or deliver them their food when you're home. So transportation is just a whole new area of, what's not a new area, it's just a whole new way of thinking of it, like some of the other topics that we've discussed today.
Yeah. Can I just say, Teresa brought up a good point, the workforce. We haven't talked about that, but the people who take care of older people in facilities, in their homes, are people who use public transportation. They're sadly low income, and they in this area, what you find is that there are many people from Philadelphia who go out to Chester County, they go to Montgomery, Bucks County, Delaware County to provide care, which means they may be traveling an hour and a half to get to their job and back. We have to do something better than that. These people, anyway, I just want to say that, and I could start talking about workforce, but it is a big issue, and I'll just make that point.
Yeah, it's definitely a place where there's lots of work to do, both through COVID and beyond.
Mm-hmm.
I want to be mindful of the time, but do want to encourage folks, if you have some questions, to continue to send those in. I wanted to just be sure we end on a note, though, as to sort of come up throughout the conversation, that there are places where for LGBT older adults, there are some of these barriers that look very similar to as they do for non-LGBT people. But there are also some places where those issues of orientation and identity, do play more of a role. And I think that's such a big thing that whether we're talking about transportation or food access or the long-term care system, is having agencies that are affirming and LGBT inclusive. And I know PCA and Carrie and AARP have all put in some of that work. But
we're platinum.
I know you have that Sage Platinum, which is wonderful. So I would love if each of you can just take a couple of minutes to talk a little bit about sort of how that's been important for your agencies, and if that has helped to, eliminate any of those concerns that many LGBT older adults do have.
Yeah, and I will say that, I wish that we could fix all the problems, and we can't, but we will be. We look at everything we do through the lens of inclusivity, and which obviously includes LGBT elders. And so we do our best. I mentioned working this into the regulations. That didn't happen in 20 years ago when they revised the regulations the last time. So that's what we're doing, is we're trying to make sure that policymakers know that this is important. It has to be stressed. We have to have those kinds of protections, both in state, federal, local policy and legislation. And so that's really what we're doing most. And obviously our staff are trained. They are sensitive to issues. They're, our staff is quite diverse. I think we're more than a third LGBT on our staff. So they have a stake in it too. And so we learn from one another. And I think that it's part of who we are. And I think that's kind of the neat part about it, is that we've been working with this for a while. And we don't think about it as much anymore, so I apologize to people for not mentioning it enough, but it is true. It's the system. The barriers are the same for many people in these things, but we certainly understand that there are prejudices and there are issues that people who are LGBT face, and we want to do whatever we can to break those barriers down.
Thanks, Anne.
I'll jump in here next, if that's okay with Teresa. I think that as not only the Area Agency on Aging for City of Philadelphia as PCA, but I think all community-based organizations, all social service agencies have to make sure that they're looking on a regular basis at ways that they could be more inclusive and culturally sensitive in the provision of services that they provide. And if they are not doing that, in my opinion, they're missing the mark. This is something it has to be ingrained in our policies and procedures. It has to be a part of our DNA, and we have to constantly and continuously make sure that it's in our practices as well. I think one of the things that I alluded to a little earlier that we have to do a better job of is making sure that we collect data that really helps to tell our story, to shape our story for the agency and shape the story for the consumers that we serve. And as we know, with the collection of data, then we're able to share those stories with our funders, whether it be our state office, the Pennsylvania Department on Aging, or our legislators. It helps us to tell our story. So with better data collection, I think it'll really help shape our message better and show that we're having a greater impact to the community than we are now, or help to tell our story of the impact that we are having with the community better. And that starts with the better data collection.
Absolutely. Yes. And thank you for that. We do like any chance we get to talk about data collection for sexual orientation and gender identity. We love it. And Teresa, I'll let you close out on that question.
Well, since we started with your introduction of me after Najja and Diane, with when we first met, David, you and Heshi and myself, and part of that great conversation when you were worried about the ogre that you were about to meet, I guess, we talked about data collection, and you guys certainly educated me an awful lot on what was missing and what we need to do, and the fact that because of those efforts of the Elder Initiative and you and Heshi and so many others, that really prompted, promoted, cajoled, encouraged, any other word that you want to add, that led to the first ever Pennsylvania soil LGBTQ Aging Summit, in the fall of 2018. I mean, and that work was designed to continue, and it's so reassuring and gratifying to see it continuing, and that's just awesome. So from my lens, ensuring that work continues, and I think I saw Terry Clark's name pop up in the chat a little bit earlier, but just knowing that Sage and the work that Terry and so many others do, and their relationship, and relationships that had already existed with AARP, is really serving me quite well, because as an association, AARP does strive, like the others that just spoke, to be inclusive in its policies, programs, and advocacy positions. And, our founder, Dr. Eltha Percy Andres, her guiding words of what we do for all really resonates, in this LGBTQ space, ensuring that all of our policies, pivot to that, promoting equality and advancing racial, economic, and gender justice. So I echo what everyone says and look forward to our continued work together.
Absolutely. Yeah, I think the data collection, the continued staff trainings, the collaborations that I know all of your agencies have done, not only with us, but with places like Sage and with William Way, and statewide with some of these LGBT serving organizations, is so vital in addressing some of these unique issues. I want to express my thanks again to Najja and Diane and Teresa. You are all brilliant and such leaders in this field, and I'm so grateful that you were willing to take the time to share your thoughts and your expertise with us at such a challenging time in our aging network and for our older adults as we navigate everything that 2020 has thrown. So again, big thank you to all of you for your contributions and your thoughts here today. Before closing out, I want to again thank our EI10 sponsors, PA Health and Wellness, Philly AIDS Thrift, AmeriHealth Caritas, the Philadelphia Foundation, and BLB&B Advisors, BLB&B Charitable, the giving arm of BLB&B Advisors. It's a mouthful, I'm sorry. For folks watching us on Zoom or on Facebook, thank you so much for joining us today. We do have one more segment of our EI10 speaker series coming up on December 15th. We're talking about LGBTQ aging advocacy. So actually building on some of this conversation we had in the past 10 minutes here. And then highlighting our EI10 events on January 14th with our virtual Cause for Applause celebration, honoring Carrie, among others. So definitely hope that you will join us for that. I think that's it for us. Thank you so much for joining us, and thank you again to our wonderful panelists.
Thank you.
Thank you. Be safe,
Wonderful.
everyone.
Thank you.
Thank you.
Take care, everybody.
Take care. Bye.
Bye-bye.